Soto, and I will be doing my video assessment on the abdomen for nursing class 3403 UTRGV. I will first identify the client, then I will wash my hands and put on my gloves. The first thing I will do before I begin my assessment is I will have the client empty out her bladder, since a full bladder may interfere with the assessment. Then I will go ahead and lay my client supine with the hands on the side or folded on her chest. I will then place a pillow underneath my client's head for comfort, and I will place a pillow underneath my client's knees to help relax the abdominal muscles. I'm going to put a pillow underneath your head, okay? And I will be putting a pillow underneath your knees.
Three.
I will now start my inspection. The first thing I will do is I will lift the client's gown to expose the abdomen. I will have the client relax and breathe deeply and slowly. I will go ahead and begin inspecting by observing for coloration of the skin. I am also looking for vascularity, scars, lesions, striae, and rashes. I will also note the abdominal contour and symmetry, observing by eye level from the side, the head, and the foot. I will have the client raise her head each time to do the inspection. I will continue observing the client as she breathes, observing for any abdominal movement, aortic pulsation, or peristaltic waves. I'm going to go ahead and expose your abdomen, okay? Okay. Go ahead and raise your head for me a little bit. Thank you. Go ahead and raise your head for me a little bit. Okay, thank you. Go ahead and raise your head for me once more. Thank you. Next, I will warm the diaphragm of my stethoscope to auscultate for bowel sounds. I will start at the right upper quadrant, then proceed clockwise. I will be listening for at least 30 seconds for each quadrant. I will note the intensity, the pitch, and frequency of each sound, and I will listen for at least 60 seconds, verifying the absence of bowel sounds. Next, I will use the bell of the stethoscope for vascular sounds. I will be listening for bruits over the abdominal aorta, the both renal arteries, the iliac arteries, and the femoral arteries. Then I will listen for a venous hum in the epigastric and umbilical areas. I will then switch back to the diaphragm, and I will listen for a friction rub over the liver and the spleen. Now I will percuss the 4 quadrants following a clockwise or an up and down sequence. Next, I will proceed with palpation, beginning with light palpation to assess for tenderness or guarding. Then I will palpate deeply in the 4 quadrants, assessing for masses to delineate abdominal organs. Okay. Now I'm going to palpate deeply. Next, I will palpate deeply in the area of the umbilicus, assessing for swelling, bulging, or masses. Then I will palpate the aorta. I will palpate deeply in the epigastric area, slightly left to the midline. Next, I will palpate the liver, noting consistency and tenderness. I will be palpating bimanually, and I will ask the client to take deep breaths when palpating. Then I will palpate by hooking. I will ask the client to take deep breaths and then exhale. Then I will move over to the spleen. I will palpate while the client is in supine or on her right lateral side. I will use the bimanual palpation, asking the client to take a deep breath. Go ahead and take a deep breath. Take a deep breath.
Three.
I'm going to ask you to take a deep breath and then you're going to exhale, okay? Take a deep breath and exhale. Take a deep breath and exhale. Take a deep breath. Now I will be palpating the kidneys using the bimanual palpation. I will have the client take a deep breath and exhale slowly, then hold her breath. I will be doing the same thing on both kidneys. Then I will do the blunt percussion for the kidneys, assessing for tenderness. I will first assist the client to a sitting position. Then I will perform the blunt percussion on each kidney at the costovertebral angle of the 12th rib. Take a deep breath, exhale slowly, and hold it. Okay, now let's do the same thing on the other side. Take a deep breath. Exhale slowly and hold it. Okay. Sit up. And I'm going to do the blunt percussion, okay? Let me know if you feel any tenderness.